David, thank you. Now to this morning's health check. Many people suffer low back pain, but sometimes that pain is due to a larger problem, such as a bulging disc or a pinched nerve. For those hoping to avoid going under the knife, there is a treatment option that is non-surgical. It's called spinal decompression. And so the practice works through a series of decompression and relaxation cycles that relieves pressure on the affected discs. Here with more on non-surgical spinal decompression and other treatments for low back pain is Dr. Dustin Etchemade, a chiropractor with Woodway Wellness. Thank you for coming in today.
Thank you for having me.
So it seems like a big medical word, spinal decompression. What is it and who might be a candidate for it?
IDD therapy and non-surgical spinal decompression is proven effective for treating bulging, herniated, degenerative disc, as well as spinal stenosis. It's widely endorsed by some of the top athletes, including Hall of Famer Barry Larkin, top orthopedic surgeons Timothy Krajcek. And it's very effective at tractioning the spine with controlled forces, gentle forces, and mobilizing the disc that's affected, which will promote healing by taking pressure off of the disc itself, the spinal nerves, and the facet joints. To become a candidate, you obviously would have to have one of those conditions or even just chronic debilitating neck or low back pain. It can actually be used for both conditions.
So when you start to feel low back pain, what are the questions you need to ask yourself and ask the people that are caring for you as you go through the process of receiving treatment?
That's a good question. You know, we want to track progress and we monitor it after each visit. For one, we should look for whether you're improving as far as severity of pain, but also increased mobility, because it's all about function. It's not necessarily about pain itself. And that's where I think a lot of people have gotten sidetracked, and they make the mistake of saying if they don't have pain, they don't have a problem. But that's not true, especially considering heart attacks. 90% of people never have a symptom until they actually have a heart attack themselves.
So, of course, whenever we are looking at something serious like surgery, you always want to get more than one opinion. And is that the same thing in this case? If you've been told that what you need is surgery, I'm guessing it's still perhaps worth trying to get an opinion?
Well, surgery is always going to be an option. What we believe at Woodway Wellness, Dr. Terry Smedstad and I, he's been in practice for 33 years, we believe that prevention is key. And, second opinions are great. Surgery will always be an option, but if you can try every other therapy that's out there, all the complementary alternative medicine therapy, such as acupuncture, chiropractic care, even the non-surgical spinal decompression, and that can help you, well, why not do that with much less side effects?
Before we let you go, let's talk about prevention, because wouldn't
Sure.
that be great if we didn't have pain to begin with or could lessen our pain on our own?
Absolutely. Well, it's interesting because the Mayo Clinic estimates that 80% of the American population at some point in time will have low back pain. And actually, the prestigious ABC News in 2011 did a study saying that the United States consumes about 80% of the world's opioid supply. But however, we only account for almost 5% of the world population. So we're over-medicated. What we need to do is focus on prevention, which of course is getting the right amount of exercise and daily activity, proper nutrition, and managing stress effectively. And if we can do all that, that's a recipe for a healthier and happier life.
All right, Dr. Etchemade, thank you so much for coming in today.
Thank you. My pleasure.
All right, so for more information about different chiropractic services, you can go to our website at abc13.com.